If you want to pump your body and expand your mind, there's only one place to go. Mind Pump. Mind Pump with your hosts, Sal DiStefano, Adam Schafer, and Justin Andrews.
Oh boy, this episode I really enjoyed. Now, Dr. Jolene Brighten, I've been getting tagged on her stuff for a long time on social media. People keep saying, we need to talk to this person. We need to have her on our show. And really, what really motivated me to contact her was when my girlfriend Jessica kept talking about her. She was talking about her information, how good it was. So I looked her up, and I definitely was not let down. She's first off, she's a functional medicine naturopathic doctor. She's the founder of Rubus Health, which is like a women's medical clinic that specializes in women's hormones. And currently she's recognized as a leading expert in post-birth control syndrome and the long-term side effects associated with hormonal contraceptives. And we talk a lot about that particular subject in this episode.
Nobody's talking about that, which is crazy. Yeah, I'm so glad that, you like Jessica brought her to our attention because, man, she is just a wealth of knowledge in that direction.
Yeah, just all about birth control, how it really affects your body. Does it, make your body want to gain body fat, how it affects your libido when you go off of it, what that's like. That's something that they've coined as post-birth control syndrome. She wrote a book about this called Beyond the Pill, and it's actually quite popular right now. A lot of people are reading it. I'm getting tagged quite a bit. Now, you can find her on Instagram. She has a great Instagram page, at Dr. Jolene Brighten. That's spelled JoleneBrighten. Her website is drbrighten.com. Of course, she has a YouTube, Dr. Jolene Brighten, and then the book I talked about is Beyond the Pill. We think you're really going to enjoy this episode. Again, she dives in deep, and we learned a lot.
Yeah. Listen up, men. This is not just for women.
No, this was an awesome episode. Before we start it, though, I want to let everybody know that this month, MAPS Strong is 50% off. Now, this is the gym workout that was inspired by strong competitors, strong men and strong women competitors. So if you're bored with your current workout, if you like to get stronger, build muscle, also have lots of stamina and conditioning, and you're bored with the traditional type of workouts, this program is amazing. It's awesome. It's half off. So here's what you got to do. Go to mapsstrong.com, mapsstrong.com, and use the code STRONG50 for the discount. STRONG50, no space. All right, so that's it. Here we are. Let's talking to Dr. Jolene Brighten. Dr. Brighten, this podcast happened for a couple different reasons. One, my girlfriend's a huge fan of yours, loves reading your posts, and she pointed me in your direction. And then the second reason is constantly getting tagged on your stuff. I've had, 30, 40 of our fans DM me at least, and this is over the last few months, telling me, you have to get her on the show, And I've gone through your stuff, and a lot of the things you talk about, I think, are absolutely remarkable. In particular, I want to talk about what your recent book is about, and I think what you're kind of most known for at the moment, which is health around the birth control pill and what that does to the body and all that. And maybe we could start with that. Like, how many women are using birth control? And let's start there, and then we'll take it.
Mm-hmm. Well, when we look at the pill only, that's estimated to be about 100 million women worldwide. And, per the surveys that have been done, we've come to understand about 98% of women have used some form of hormonal birth control at some point in their life. And even if they've just tried it at some point in their life. And what's sad about this is that the majority of women are now using birth control for symptom management. And why I say it's sad is because there's a lot of opportunity there to help address root cause issues, but it also means they're being dismissed. Like, they're being passed hormonal birth control with no question as to why are you having these symptoms to begin with.
Can we talk about some of those symptoms that women are being prescribed birth control for?
Totally. So we see heavy periods, what we call period problems. So heavy periods, irregular periods, painful periods, certainly acne. We see issues with headaches, migraines really being met with a hormonal contraceptive. And really the answer in a lot of ways is pretty disrespectful in women's health to say your reproductive system isn't necessary. It's completely negotiable. So let's just give you a medication to shut it down, rather than recognizing that these signs, these symptoms are actually directing you towards what is going on. So an irregular period, for instance, that may be due to hypothyroidism. So hypothyroidism is not going to get better with hormonal birth control of any kind. In fact, it can actually make things worse. And the problem is that, well, she may have those regular pill bleeds. Those are not actual periods. Nobody's checking in on her because those symptoms are taken care of. So we fixed the problem, so to speak. But meanwhile, her tissues are allowed to degrade as she is not receiving ample thyroid hormone. With polycystic ovarian syndrome, which I'm sure you guys, in the fitness arena come across PCOS women because, a lot of times their doctors are like, you just need to lose weight. That's your problem. It's very difficult to lose weight when you're inflamed and you have insulin resistance kind of programmed in you. And we understand that these women also have changes in their gut. So there might actually be something going on in their gut health, which we're going to talk about why birth control is not a good idea for your gut health. But with that, it's a metabolic disorder. It's inflammation and insulin dysregulation and likely gut dysbiosis driving this condition, which can present with hormonal symptoms. And certainly, nobody wants hair falling out of their head or growing on their chin and chest. So I totally feel for these women wanting, any solution to shut that down. However, if you add birth control into the mix without discussing with this woman that you're at higher risk of infertility, higher risk of heart disease and stroke and diabetes. Birth control puts you at higher risk for those things as well. Like, you didn't do your job as a physician in making sure she had the full story to make the best decision for herself.
Do you think we've been led to believe that birth control is just kind of this symptom-free, side effect-free, benign type of medication, and that the only purpose for periods and the only things that we get from this is just you either get pregnant or you don't? Do you think we've been kind of misled in that direction?
Well, and I think like what you said right there is a bit of the issue, is that we've been so focused on the bleed and the period when really the main event is ovulation. Like, that is what the entire cycle. And so if we were really going to start day one of the cycle, it'd be like day one should really be the day that you ovulate. Like, that's our prime time. That's the main event. But that's tricky. So when you see blood, it's a little bit easier. And so we categorize that as day one of the menstrual cycle. I think the other issue with it as well, I think that doctors do recognize, and we do recognize their symptoms, but the story that plays out is that the risk of an unintended pregnancy outweighs the risk that comes with hormonal birth control. And that often, so doctors are not educated about, I certainly wasn't, many of my colleagues weren't. I have gynecologists, which mad respect to them, reaching out to me saying, oh my God, I never learned any of this, and I've been prescribing birth control for decades. Like, thank you so much for making this information available. So they don't know. So when a woman comes to them and says, hey, I'm having these side effects, well, they might even say side effects. They might say, I have these new symptoms. They don't really think that could be a side effect of hormonal birth control, because there's a compartmentalization in medicine, which is that, you have lady part problems, you go to the gynecologist. You have tummy troubles, you're going to go to the gastroenterologist. Something's up with your joints, maybe it's autoimmune, let's get you to the rheumatologist. And if it's lady hormones, gynecologist, any other hormones, endocrinologist. And at the end of the day, your body doesn't care. Like, we can compartmentalize all day long, but everything is connected. And that's where I think in that conventional paradigm, things have kind of gone awry in women's health, is that they think this reproductive system is negotiable. You can just light switch, turn it on, turn it off, and that those hormones aren't going to impact every system in the body. And when you start to understand that every single system is impacted by hormonal birth control, it's very easy to see how women present with an array of side effects.
One thing that really fascinated me a long time ago was I read this study that talked about how women's preferences for like their mate. In other words, they did a study where they took men's faces and they masculinized them and feminized them. So same face, slightly more feminine, slightly more masculine. And when women were ovulating, they were more attracted to the masculine face. And when they weren't, they were more attracted to the feminine face, even though the faces were the same and there were subtle differences. And then I read another study that showed that when women were on birth control and they got married, when they went off, there was a slight uptick in divorce. And this got me thinking, like, it doesn't just affect the fact that you can't get pregnant. It kind of affects a lot of different things. Let's talk about that for a second.
Yeah. And, that's one hypothesis I have of sometimes why women come off of birth control and have difficulty conceiving is it might be a mismatch in their partner. And so I don't have substantial evidence, to back this up. So if anybody's like, where's the study? Please go do the study. I would love to see it and know, is this true? But this is how it starts. We start asking questions based on observations, and then we get into the research. So with them, we select our mate. There's several variables at play, but one of them is the pheromones and the way they smell. So ladies, if you are ever super into the guy at the gym who's like super sweaty and you're like, I just can't get enough of him. That's it's his MHC complex. Is that you? All the ladies.
Usually.
He's lying.
You're like, I do a squat, the ladies come a-running.
Pretty much.
Yeah. Well, what women are actually picking up on is genetic variations through the MHC complex. Now, this is a protein that presents antigens to your immune system. So basically, is this good? Is this us? Or is this bad? Should we attack it? Now, that MHC is very, very important in terms of like, we select that mate and we're selecting someone as opposite as possible from us, genetically speaking, so that our baby gets, basically the buffet of genes to choose from and is the most viable offspring. So Mama Nature's got your back in this. However, when you introduce hormonal birth control, this is where everybody says, ooh, because we tend to select mates who are genetically a little more similar to our cousins, a little more similar to us than
keep it in the family.
That's
interesting. Yeah.
So there's a part in my book where it's called The Pill and Your Bad Boyfriend, and how many women have written me and said, wow, like understanding about choosing like mates and how it impacted me. This explains so much about my first marriage, about my bad boyfriend in college, about why I was so into, I have had women. And I tell a story in my book about this girl who was really into this guy. She got on birth control, wasn't into him anymore, and it just kind of yo-yoed like that. And we see that. Birth control alters our brain at the structural level. It also, can impact, so many things like tryptophan pathway and free radical production and things that can lead to mood shifts, mood changes. And we've also come to understand that we don't pump the brakes when we should in risk-taking behavior. We don't have the same fear response within our brain. And as we talk right now, it's 2019, and you know what? No one's been really questioning what happens to the woman's brain when you leave her on birth control for decades at a time. We've all been told it's safe, don't worry about it, and say thank you when you have your pill because, pharma gifted this to you. And 100%, I did the pill for 10 years. I'm a first-generation college student, super grateful. People are always shocked when they're like, you wrote this book and based on everything would you go back and do it differently? And I'm like, I don't know, because I did not want to get pregnant. And that's the thing that made the most sense to me. And also, I started at 17. Anybody who hangs out with 17-year-olds, how much information can you give them and them not eye roll at you? So I don't know. I'd like to be like, oh, yeah, I'd be so smart. Nah, I don't know about that. Let's be real. But the impact on mate selection goes both ways as well. So
really
interesting studies that so strippers who are or exotic dancers. I want to be PC about it, but
this is mind pump. You can say whatever you want.
Okay, because when I grew up, that's what we said. It's just like actors, actresses, and now they're all actors. And I'm like, I'm trying to get there, guys. But with them. If you're on hormonal birth control, you're an exotic dancer, your tips are going to be a lot lower. And if you're and
no shit.
Crazy, right? So now it's cutting into your bottom line.
Yeah, literally.
Yeah, literally. The other interesting thing, though, is that when you're ovulating, you'll actually make more tips. So men actually will tip higher for women who are ovulating. That's, again, them picking up on that scent. There's also things that happen when we ovulate, leading up to ovulation, estrogen is rising. No, estrogen is not the devil, but it can be. She's a diva. So if you don't put her in check, she will take over the stage and it'll be over. But she plumps you up. So fine lines, wrinkles start to go away. Breasts are more full. Hips are more full. Lips are more full. That's why I'm not currently ovulating, but that's the ideal time for women to be on camera because you're like, I just look so pretty right now. But men pick up on these things. And there have been primate studies about how injecting the females with Depo-Provera, which is one form of birth control, actually, it influences the male's behavior. So if you inject these females, these might be his mates, you inject them, he doesn't want anything to do with them. He selects new mates who are not on birth control. You inject them all, and he actually starts to ride the crazy train and is abusive, is aggressive to himself, to the females.
Wow.
And so it has a big impact. And these are the things things we're not talking about. We're told we're not supposed to talk about it. We're told that we're anti-women if we talk about it. But we have to talk about it because all of this is going on. And we have to understand how this is impacting the entire human race. Because I don't know about you, but I'm pretty invested in our species surviving. I have a small human at home. I'd like to see let him thrive.
Yeah, for sure.
Wow. So it's fascinating because I think we start to forget all of those, I hate to use the term instinct, but instinctual things that we have in terms of when we're, selecting a mate. And these things we've evolved with, and they've helped us pick and select good genetic mates. And of course, there's other decisions that need to be involved, not just who you're attracted to, but that's also something that we should definitely consider. Are there differences?
Yeah, we're messing with the gene pool.
Yeah.
Like, it's potentially, this is not something that we've questioned. Is like, wait a minute, but if we're all selecting for potentially weaker immune system prodigy, like, what does this mean for autoimmune disease that's rising? What does this mean about inflammatory conditions? And it's, it's something that it's a hard conversation to have because I did the pill for 10 years. I spent a year prepping my body before I had my son, but it's something that I don't even want to think about what decisions I made in my 20s impacted the health of my son in the long run. And nobody wants, we're not shaming anybody. We're not feeling guilty about it. Okay, ladies. So whatever happened, it happened yesterday. Today's an opportunity to move forward and do things differently. But it's a big question, right? Wait a minute, what's actually happening to the genetic diversity?
What do we know about that? Are we starting to connect things with people that have been on birth control for a long time with autoimmune issues?
So there is a correlation between women developing autoimmune disease while they're on hormonal birth control. Okay. So increased rise in multiple sclerosis, MS, inflammatory bowel disease. In fact, a study came out of Harvard and showed that if you have a family history of Crohn's disease and you're on birth control for 5 years or more, you have a 300% increased risk of developing Crohn's disease. No joke, right? Huh. And so for people who are listening who are like, oh, what's Crohn's disease? It's ulcers through the whole tube. Sometimes in your mouth is canker sores, which if you're on the pill and you're noticing you're developing new onset of canker sores, you need to go to a gastroenterologist or at least your PCP and get that looked at. That could be a first sign of Crohn's disease. And you can get ulcers all throughout the digestive tract. You have malabsorption issues. It's very painful to eat. They can perforate. Then you can end up with a life-threatening, condition in the hospital. So it's no joke. And for women who are on birth control, it's very small studies that have been done. But if you have Crohn's disease and you're on birth control, they estimate that for about I believe it's 1 out of every 83 women will require an additional surgery. So every year that you're on it, you're going to have an additional surgery in your gut.
Wow. And here's a speculation I made a long time ago. I'd love to hear your input on this. We've noticed that now for the last, I think it's 5 or 6 decades that the average male's testosterone levels have been dropping. And I'm wondering if it has anything to do with the fact that women are selecting men with lower testosterone now as a result of birth control. And if that is playing a role in the lowering of testosterone because it's less valued as an attractive partner.
Totally. I mean, that could be a possibility, especially when you're talking about the study of I'm such a Game of Thrones fan. So if you're ovulating, Drago, you're going to be like, oh, Drago, I'll be your Khaleesi any day. And that's that manly man. And that's not to say women that whoever you choose, it's all on you. You can have whatever selection you want to have, but with that, the more feminine face, lower testosterone, right? And selecting for that while on hormonal birth control or not ovulating is a very interesting thing to raise. But you know what women do, anywhere from 10 to 20 times a day while they're taking the pill? They pee. And that goes into the water supply. They also have bowel movements and they poop. And it's estimated about 50%, upwards of 50% of that pill can actually make it into the large intestine.
Wow.
So these things are making it into our water supply, compounded with the fact that xenoestrogens are everywhere. We have this bad habit as humans of introducing a chemical into the environment and then asking questions decades later of what did that do? Or noticing changes and being like, oh, snap. But the person who this is the worst of it though. The person who notices there's issues, this is how it generally goes. The person who's like, this is a problem. They're usually the ones that they're like, they're a quack. Stop questioning it. It's fine. This is the best thing since sliced bread. And it's a real problem because that's another issue is that we talk a lot about at least in my world, xenoestrogens, endocrine disruptors, how those impact women's health overall. And yet this is something that can also equally affect men. And it's something that I've had insurance companies, lab companies, because I will put an ICD-10, a diagnosis code of estrogen excess in a male patient. And the insurance company or the lab's like, this isn't right. This isn't a man's diagnosis code. We use this in women. I'm like, yeah, except he has no testosterone and his estrogen is through the roof because of aromatase activity, but also that he's drinking out of plastic water bottles and microwaving out of plastic and using this sunscreen. And we think about it less with men because they use less personal care products, but still, we're all inundated with this. And, to your point of talking about evolution, the thing we forget is that we're all animals. I think it's inconvenient. People don't want to think. We want to think I'm better than a rat. Of course we want to think that. But look what's happening to animals. As it is right now, we're looking at 1 million species going extinct. We are just a little bit higher up on that food chain.
Yeah, I 100% agree with you. Now, what about side effects? These are the questions that we get all the time. How does birth control affect my ability to build muscle, burn body fat? How should I change my diet? What should I do in terms of my fitness and my aesthetic goals?
Yeah, birth control can 100% sabotage your fitness goals, and we can talk about a few mechanisms of that. But one big one is that women need testosterone. So we've been talking about no hormone is bad, and we've all got them. Just based on male and female, we've got them in different ratios. And so with that, testosterone is really important for a lot of things. So automatically everybody's mind, I know your mind just went there, went to libido. That's the first place we go. We're libido, it's everything. It is everything.
You do know me. Called out.
I know. People on YouTube are going to be like, that moment just happened.
You saw it in your face. Yeah.
I just felt it. He was I heard Marvin Gaye playing over there, and I was like, see you. Let me say this though. Libido is a sign of vitality, and women who have a low libido, they usually have something going on. Maybe it's that bad boyfriend. It could be that, but it may also be a hormone imbalance because, again, we're animals and we want to procreate, and having a libido is part of that. So this is why women lose their libido on hormonal birth control. It downregulates the production of testosterone by as much as 50%, and it alters your liver at the genetic level so that you express more sex hormone binding globulin. That is a protein that gobbles up your testosterone. Now, this is not because your body's dumb or betraying you or you need another pharmaceutical. This is your body protecting you. Because how does the pill work? It is a high enough dose. So this is where I always giggle when people are like, well, my doctor said it's low dose. Yeah, compared to the 1950s trials that killed women, yes, it comparatively speaking. However, it's still a high enough dose that you take it orally. It passes through your liver, so this is what we call first pass of medication. Your liver gets a chance at trying to break it down, but it's still high enough that it shuts down brain-ovarian communication. So it's still high enough to do its job, which is shutting down your ovulation and your ovarian function. So in that, your body knows this is way too much estrogen that I should be dealing with. So let's increase sex hormone binding globulin so that we stay safe.
So that we don't procreate, we don't mate.
Well, the sex hormone binding globulin grabs onto excess estrogen, so only free hormones can stimulate tissues. And so this keeps you from overstimulation of estrogen. So again, your body's really smart, but this is an epigenetic variation that can cause your genes to express proteins differently. This sex hormone binding globulin goes up while you're on birth control. Then the researchers tested women after the fact. What they found and what they concluded is that it never returns to the state of a woman who never used hormonal birth control.
Never?
Never.
Wow.
Yeah. And so I will say that they haven't done long-term studies on this. And clinically, I have been able to help women bring down their sex hormone binding globulin and get their libido back. The whole protocol is in Beyond the Pill because it's all about epigenetics and how you are signaling to your liver and clearing up the whole system that puts estrogen in check.
Now, does the length of time that you're on it matter in terms of like how, you can recover and get back to that like natural state?
Yeah, that's a really interesting thing is that it seems to be in all the research I've read is that 6 months tends to be the sweet spot. Now, I've definitely talked to women who used it for 5 days, had new onset of panic attacks. It didn't go away when they stopped. And so, those are a little bit of our outliers. And it's what we need to start asking, why is it true for for one woman and not another, and stop arguing about whether or not women are telling the truth. Like, and we'll talk more about depression. That's a big area where women get dismissed a lot, even though it's on the package insert of these pharmaceuticals. Mm-hmm. So we're talking about body composition. And so if hormonal birth control drops your production of testosterone and your ability to have free testosterone stimulate your tissues, you will see a decline in muscle mass. You can also see that you're crying all the time, you're not motivated, you lose your kick-ass edge, and you don't have energy throughout the day. Those are symptoms of low testosterone. We need testosterone just like we need estrogen and progesterone in our brain to keep it healthy and young and neuroplasticity going so we can learn new things. So with that, if your testosterone drops, now you're not going to get muscle cell stimulation in the same way. And estrogen and fat cells are besties. So your fat cells love to make estrogen, and estrogen comes in and is like, you're doing such a good job. Let me stimulate you a little bit more. So you plump up and you get a little bit fatter. And so that can affect the adipocytes. And then we see that muscle mass starts declining. Now, my graduate research in nutrition was on sarcopenic obesity. So this is a topic where I don't mess around with, because I'm like, and for people who don't know what that is, think about the M&M guy, okay, the round M&M body and the little arms. And I think that's still a thing.
Yeah.
I actually have never owned a TV.
So
I'm like, I'm pretty sure that's still a thing.
Yeah.
Yeah, so with that, you've seen people like that. Mm-hmm. That's sarcopenic obesity. They're losing their muscle mass. They are deleting muscle cells, replacing it with fat, infiltrating their organs. Now we've got a big problem, because that's setting you up for increased morbidity and mortality. You're going to get disease and you're going to die, and nobody wants any of that business. So we've got the impact of testosterone. Yes, that can shift our body composition. We know that in general. Like, why is it athletes are not allowed to use testosterone?
Right.
Because it can help. It can definitely increase your edge. Now, the other thing that has been observed about birth control is that very much that narrative of like periods make you the lesser, having a menstrual cycle is a burden, has played out in sports. I'm hitting my mic. Sorry.
Yeah, no
Sorry, guys. And it's played out in sports to where they thought, well, the solution is just control her with hormonal birth control. Then she never has a down day, can always perform. Turns out that's not totally true. And in fact, being on hormonal birth control, some women fatigue faster. So the endurance athletes lose their endurance edge. Like lifting, they find that their threshold of failure is coming a lot quicker than what they expected before. And so that's just one way it can impact body composition. Now, we hear often that there is no correlation between birth control and weight gain. And what's really interesting about this is when you get into research, what you come to understand is all they did is they took all the women in the trial, added up their weight. So what was the change? Some lost weight, some gained up to 70 pounds. And then they just said, okay, divided by the number of women, okay, on average, it's a 5 to 10 pound weight gain. That's not significant. I'm like, I'm not even 5'5". If I put on 10 pounds, it's significant. Like, you're going to know it. So it depends on that woman's body. But also, what is up with the woman who gained 60 pounds? And if you had women losing weight, why was that? A lot of them get nauseous. They can't eat. Like, other things are going on. And so with that, the question is really like, what is true for this woman? Sometimes the weight gain is because birth control is inflammatory, which will cause us to hold on to water weight, which is why if a woman comes off, she's like, I lost 3 pounds immediately, water weight. That's water weight. But there's other women who come off and they find they struggle. They struggle to build muscle mass. They struggle to lose weight. They feel like, they're eating less, they're moving more, they're gaining more weight, they're doing everything right. And I very much think this comes down to mitochondrial function, because the population I see it impacts the most are perimenopausal women. So mitochondria, for people listening, are the powerhouses of your cell. They generate your energy so that and this is why we rest between sets. So when you lift weights, you rest, your mitochondria can kind of regenerate, refuel, make that ATP. Hormonal birth control depletes key nutrients that those mitochondrial organisms need to actually do their job right, like CoQ10. Now, the other thing that's interesting is that evolutionary spectrum, we have those organelles, the mitochondria are actually bacteria. And hormonal birth control's impact on the microbiome has been compared to antibiotics in terms of how it decimates the microbiome. I mean, can you imagine? You're on a medication. We know the microbiome's everything now. In the 1950s, we did not. In the 1960s, when the pill stepped on the scene, didn't totally understand that. But we do understand now that if a bacteria in your gut is killed by an antibiotic, mitochondria, it's a toxin to mitochondria as well. So if hormonal birth control can kill bacteria in your gut, it therefore could be a toxin to mitochondrial health as well. And mitochondria, yes, they live in your muscles, but they're also concentrated in your brain and your ovaries. And this is important for protecting your eggs. So this could be part of how birth control can contribute, not cause fertility issues after you come off, is that you are making less CoQ10 because you're getting older. And you've depleted it. So your mitochondria are not protecting your eggs the way that they should be. And this also calls into question, why are women at the highest risk of Alzheimer's and dementia? Like, why have we not questioned the role of hormonal birth control in that? When we know that 100 million women worldwide are taking it, 66% of the Alzheimer's patients are females, it's time we start questioning this. And there are female researchers who are just starting to get into this, but I'm like, man, it is 2019. In the 1960s, women were taking this only if you were married. Could you get it? In the 1970s, it finally became accessible to all women. And yet now we're just now being like, oh, wait a minute. Could it actually be doing something to these women long term?
So now that we've scared the shit out of everybody that's taking birth control.
Oh God, no! Shut up. You guys have to slow my roll on that.
No. It's like, now I'd like to talk to you about, like, what are some of the what are the steps that when you get somebody who comes in and they're curious, like, yeah, I'm listening to this show right now and I'm taking birth control. I obviously wouldn't. I'm pretending I'm a female right now. I'm taking birth control and I'm concerned. What are some of the things that I can do potentially to either, one, mitigate some of these potential side effects or look out for them? Like, what are some of the things?
What are the options out there?
Yeah.
Totally. Yeah, because if you don't want a baby, you got to do something not to have that baby.
Right.
So here's the deal. First things first, like, if you're on hormonal birth control of any kind for whatever reason, that doesn't make you an idiot, a bad person, or any of these things. And I say that because I'll see on social media where people are like, you're using birth control because you have painful periods. That's so dumb. And like, shame. And it's like, you don't know her. What if she has endometriosis?
Right.
Like, she could be vomiting half of the month and not able to leave the house. Like, there is a time and a place for birth control, and it's not up for me or anyone else to decide. This is a decision that woman has to make, with the caveat that, like, if there are like stroke risk factors and things like that, then we got to shut it down. But in Beyond the Pill, this is what I really aim to do. If you're on hormonal birth control, I got your back. If you want to come off of it, I want you to know there is life beyond birth control. Like, there are things you can do to transition off without being afraid. And if you have symptoms going on, there are solutions beyond birth control. I know you can always go get birth control, so let's give you alternatives as well, and also give you the full story, so that if you start birth control, you know what labs to test, when to talk to your doctor, what symptoms to look out for, and how to reduce those side effects. And it's the funny thing, because people who haven't read the book will make a comment of like, I bet Big Pharma hates you. I bet Bayer hates you. And I'm like, why would they hate me? I'm actually like helping women lower the side effect risk, and like I'm making happier customers. This is like, no, there's no, and it isn't us versus them, because people will be like, you're obviously anti-pharmaceuticals. I'm like, I'm hypothyroid and I take a thyroid medication every day, and I'm super grateful that pharmaceutical companies exist so that we can have those tools for the time and the place. So if you're on hormonal birth control right now, what do you need to do? Number one is replenish nutrient stores, for sure. So you need to be on a prenatal or a multivitamin of some kind, most preferably with activated B vitamins. It needs to have magnesium, selenium, zinc, these things that hormonal birth control are depleting. You cannot out-diet hormonal birth control depletions, just like any other medication depletion. You cannot out-diet it. Should you try? Absolutely. So what do I mean by that? Like, we have to get the diet dialed in, but understand that if you're on a medication that's causing you to lose these nutrients, you need to bring in some kind of supplement form to help replenish.
Now, that being said, are there diets that you are just not a fan of because of that? Like, are there specific, for example, right now the biggest diet is ketogenic diet in the last year. Are there certain diets that raise a flag for you and say, that's probably not something you should be doing because you're on birth control? Yeah.
So I don't like to do diet dogma, and because I don't believe there's a one size fits all for everybody for their whole life. That's a very important thing to understand, is that especially as women, if you get pregnant, if you're breastfeeding, if you're perimenopausal, menopausal. Like we have different needs at those times in our life. The recent carnivore diet, probably not the best idea for women. If you're eating beef heart, you can get your CoQ10 back in. And actually, I will say that like 25%, you can go to the butcher, ask them to do 25% grass-fed beef heart ground with 75% grass-fed beef and make a hamburger out of it. It's like the best hamburger you'll ever have. It's so good. And it'll be loaded with CoQ10 as well. So that's got that benefit. But with that, we need to be fueling detoxification. So we've got to support the liver. So I talked about not only at the genetic level, but also at the structural level, with the introduction of hormonal birth control, women who are on the pill have higher incidences of liver tumors, which researchers are like, they're benign. So that's great. They're not cancerous, but they're prone to rupture and they get pretty big. And your liver is having a lot of blood flow through it. So that's no joke. And in addition, you just lost a part of your structure. Like your liver does so much for you. Like love your liver every day. And so why I'd say not the carnivore diet is because we need to be bringing in cruciferous vegetables while we are on hormonal birth control. And really, women as a whole need to be eating cruciferous vegetables, broccoli, kale, cauliflower, cabbage. If you don't tolerate those, so for women listening who are like, I have small intestinal bacterial overgrowth, or I eat those, I get gas bloating, you want to default to sprouts. So broccoli sprouts, kale sprouts, just sprout. For my college peeps out there, people always write me, they're like, I'm a poor college student. I'm like, oh, I did that for 10 years. I totally feel you. And then student loans got me. So still doing it in a lot of ways. So, but with that, I'm like, if you got paper towels and Amazon Prime and they can ship you organic broccoli seeds, you can actually sprout those in your windowsill and eat them. Like super easy to do. And sprouts actually win in the research in terms of supporting estrogen detoxification and supporting your liver, giving the nutrients it needs to get that estrogen out. And really process all your hormones, environmental toxins as well.
Dr. Brighten, is it the indole 3-carbinol that's in?
Yeah, that then gets converted to DIM.
Okay. So would supplementing with that be okay as well? Or?
Oh yeah. Okay. So my balance formulation actually has DIM in it and broccoli seed extract as well. I keep it at a lower dose. I've just had somebody recently be like, "Oh, I was taking 700 milligrams a day and having headaches." I'm like, "Yeah, that's a little bit much on that." It's a very important point that you bring that up, though, because DIM is super, super helpful with that estrogen metabolism and supporting liver detoxification. However, I'm telling you right now, you need to eat your broccoli sprouts, you need to eat these cruciferous vegetables. If you don't chew it, or you don't have ample stomach acid, you won't actually convert into DIM. So you won't get it there. So what can you do? Take a shot of apple cider vinegar before you eat your meals. That can help.
Okay.
But if you are somebody who experiences heartburn and you're on hormonal birth control, please get it checked out. It could be imbalances in gut flora. It could be your first sign of hypothyroidism, because without ample thyroid hormone, we don't make hydrochloric acid. And most of the time, if you've got heartburn, it's because your stomach acid's too low. So the apple cider vinegar, though, quick and easy trick to try to get that stomach acid up to be able to make that conversion. So we were talking about the diet. So that's why, I'm somebody who always holds space for curiosity. I mean, that's really how science operates. And maybe the carnivore diet will be like something where it's like, whoa, actually cycling out of that. Like we see that women often cycle in and out of keto. It's better. They do better in that way.
Yeah.
And we have to remember that most research is done on men, and then they just say apply it to women. And the keto diet is one of those things that it's like most of the research was done in children. When I first learned about keto diet, it was for controlling epilepsy, and it works well, like really well for neurological health. So, if I had a woman, say that's coming off of birth control, she's, 48, she's having brain fog, family history of Alzheimer's, dementia, low bowel sounds. So for women listening, if your doctor isn't listening to your tummy, make sure they do that, because the absence of bowel sounds, that can be degeneration of your nervous system, and that can be early signs that you're going to have neurological degeneration as well.
Wow. Interesting.
Yeah,
like an early sign of Alzheimer's.
Everybody just looked at me. Like, what?
Well, that was one of those.
I feel like Justin's never going to have neurological
You stick the microphone to it.
Let's keep going this direction. I like going through the diets and some of the things to look out for.
Yeah,
let's get into another popular one, like vegans. What do you see with that?
Yeah, vegan is a tough one, and it is something that like I've worked with lots of vegan patients, and the thing that like I started this, I don't do diet dogma. So like I was a vegetarian for 10 years, and that was like my identity until I became iron deficient anemic because I had a copper IUD, my periods were too heavy, and my doctor was like, recommending iron sulfate, which is terrible and will constipate you. Ladies, don't use that. Don't use that form. But they were like, you have to take 325 milligrams of this iron sulfate every day. And I'm like, but what I'm hearing is my diet's not working. And they were like, yeah, but you're a vegetarian. We wouldn't ask you to eat meat. And I was a vegetarian, but also a nutritional biochemist. And I'm like, I have always been a food first person. And it was hard for me to swallow and to handle that, like, oh my God, my diet's not working for me. And I thought I was doing a really good, healthy thing. And I actually started it with buffalo and then organ meat. Oh my God, that was hard.
Wow, you went from vegan to organ meat.
No, I was vegetarian.
Okay.
So and I was lacto-ovo vegetarian for people who like their labels. Get specific with that. So with that though, with vegans, the thing I say to people is like, look, whatever you want to decide, it's your body, it's your life. But if you're my patient, you have to be in a place where we can hold space to have the dialogue. That if your diet's not working for you, if your labs are showing me your symptoms aren't showing, we've got to be able to have that discussion. And if you decide that like you don't care and you're going to stay vegan and you want to take all these supplements and do all these things, that's fine. And it's something that let me say this, though. I think this is one of the mind-blowing things that people read in my book, and it's very interesting that I'm like, oh, I didn't realize people didn't know that. But of course, why would people just know this? Women and men, but women especially, rely on their natural estrogen to make the conversion of the plant-based omegas into EPA and DHA.
Oh.
Now, we suck at this altogether, okay? We are highly inefficient as mammals in our ability to do this, but we need our natural estrogen to make that conversion. If you are on hormonal birth control, you do not have the estrogen to make that conversion. You're going to need a fish oil or a animal-based omega-3 fatty acid. And I've had people say, well, what if I just take algae? And if you are a vegan who's doing it for the planet, and you compare how many algae capsules you have to take to a fish oil capsule. By the way, I only advocate for sustainable fishing practices, screening, third-party screening of fish oil. You make sure there's no heavy metals, PCBs, any of that stuff. It's got to be on the up and up. But however, if you are going to match that dose of 2 capsules, like we're talking about some people, therapeutically, they may be going through 3 or more bottles a day. Now, how much plastic did we just put in the environment? And so this is the thing, like these are ethical dilemmas. And what does that mean when it's an ethical question? There's really no right answer. Like we've got to have the discussion. Totally. Yeah. So with the vegan diet, something that many of us clinicians who work with autoimmune patients have come to observe is that there is a high correlation between a vegan diet and autoimmunity. It may be because they lean on grains and soy a little bit more for protein. Not everybody does that. It may be that. It may be that the things that they're eating actually lend themselves to intestinal hyperpermeability and are inflammatory. It may be because they're not getting enough nutrients coming in. I mean, it could be all of those things as well. And so this is something that, like, when I approach the conversation, like, you're going to do what you're going to do, but you still need to have this information and understand that, like, you may need to choose differently while you're in a healing phase. And, like, some people are very passionate about their veganism. And I've talked about how I've had patients who are like, I'm going to eat collagen. Like I'm going to do this. I still identify as vegan. I'm going to do this temporarily. I'm healing my gut. I feel like this is going to be the best thing for me. We support them in that. And people are like, well, then they're not a true vegan. And it's like, or they were in a healing phase. Just like, when you're in a healing phase, you might not go out with your friends and you might be sleeping. And does that mean that you're antisocial and you hate people? No, it might just means you're in a healing phase. You have to do things different for a period of time. But really, my favorite quote, I think I say this like 10 times a day, is Albert Einstein, which is the definition of insanity is doing the same thing over and over and expecting different outcomes. And so if you're someone listening to this right now and you're like, I'm eating the same diet over and over and I'm not, things aren't changing, it might be time to rethink that. And I'd also frame it that it doesn't matter what the diet is labeled. everybody can be eating a standard American diet in terms of the lack of nutrients and it being a bunch of processed food. And, whenever I go through the frozen food section, which is usually me skipping lines and trying to get out of the grocery store, but I'm always blown away by the number of packaged vegan products. And so
highly processed.
And to that, so if you're vegan, you're vegetarian, you're keto, you're whatever, most of your food shouldn't be in a package. And like if you do need grab and go stuff, then it's got to be on the up and up, and you've got to really be evaluating it, because you could be eating a vegan diet and you're thinking, I'm doing a really good thing because I am, cutting out all these animal proteins, therefore it's good for my health. But then you're eating, tofurkey and fake chicken and fake bacon. To that, I'm like, why don't you just eat the real stuff if you're jonesing for it that hard? But the same is true, for any other diet is out there, is that, people will think I'm eating paleo. That's healthy. Now they're buying all the paleo packaged stuff. I'm eating gluten-free. I love it when my patients are like, so I went gluten-free and now I've been having like my morning muffins and I'm eating cookies. And I'm like, would you have eaten that otherwise? Well, no, but it's gluten-free. I'm like, oh, snap. Marketing got you. Okay. I should have educated you on that. But this is an opportunity for education. And that's really what it is. When we have these hiccups, it's an opportunity for education. It's not shaming you. I'm not telling you did something wrong. We've all done dumb at some point, and it's incredibly instrumental in us learning. I mean, my son, he's 6, and I'm like, can you please learn the easy way? Because as your mom, it hurts to watch you learn the hard way. And then he falls off something and I'm like, oh, it's like you just must. This is what humans do.
Dr. Brighten, you brought up a couple times the depletion of CoQ10, which I know is a nutrient that's imperative for, among other things, heart health.
Yeah.
And I know that statins also deplete CoQ10. What happens when you have women who are on both birth control and statins?
Oh, that's such a good question, because when you get into the Reversing Metabolic Mayhem chapter of my book, I talk about how hyperlipidemia and birth control go hand in hand. So we see drop in HDL, rise in LDL, so bad cholesterol, and triglycerides. Now, understand this, since the 90s, we've known cholesterol is not bad. And I still just eye roll when people are like, don't eat coconut, don't oil, don't eat butter, don't eat this and that. I'm just like, whenever people are like, butter is back, I just play LL Cool J in my head. Don't call it a comeback. I've been here for years. Yeah, you know that jam.
I got you.
I love that song. LL, if you're listening, you're amazing.
I'm sure he is.
Of course he is. What else is he going to be doing? He's like, oh, Dr. Brighten's back on. I got to get in on that. He's going to talk about lady parts. That's all of it. Oh, that's hilarious. So with that, this goes back to the liver. We generate cholesterol in our liver. So your liver's taking a hit. Your liver takes one for the team while you're on hormonal birth control. And so we see elevations in cholesterol. Now, we've known since the 90s cholesterol is not bad. No, women. In fact, this is how you build your hormones. However, cholesterol, when there's inflammation, that's where we get into trouble. And that's where we get plaques in our heart, and they can become disrupted. It's not your immune system. I'm not going to nerd out too much, but it gobbles up that LDL and makes these little foamy plaques in your blood vessels. So that's a really bad thing. And so then your doctor comes in and says, well, you're on, they don't even care that you're on birth control. They're like, you have elevated lipids. Let's give you a statin. So now we know that statins degenerate your brain. I don't know that I can say they degenerate your brain, but they ain't doing you any favors. And so now we've got further depletion of CoQ10. Hormonal birth control is inflammatory. So if it's inflammatory and it raises your cholesterol, that's a potential for cardiovascular risk right there. So, we're leaving women on it for decades, but also we're putting PCOS women on it who are already at higher risk for these things. So we have to keep that in mind of who's the individual in front of us and who are we actually prescribing this to. So yes, the statins can be an issue. Metformin's another. So hormonal birth control can cause insulin resistance. And in fact, if you've been on hormonal birth control, so to your point of when does stuff get bad, 6 months or more in your entire life, when you enter into menopause, you're 35% more likely to develop diabetes.
35%.
35,
Holy
right?
cow.
It's crazy. So with that, metformin is often a drug of choice to help with this. And, having high blood sugar is not a good thing. You like your liver, your kidney, or your eyes, your kidneys, these major organs, just keep them healthy. However, metformin depletes B12, also depleted by hormonal birth control. Now she has brain fog and she's, having, she's forgetting where she put her keys. And people are like, you're just getting old. No, that's a B12 deficiency.
Wow.
B12 deficiency can present like dementia. So we have to be looking at that. And what's interesting is that when I've talked with pharmacists, this was really eye-opening for me, is that pharmacists who are just handing out drugs all day, and yes, birth control is a drug, they're like, when we pass women that birth control pill, we know it's a matter of time until she comes back with a thyroid medication, with an antidepressant medication, or with a proton pump inhibitor because of gastrointestinal upset. So they see this, and they've been seeing this for decades, that once, and this kind of how it goes with medications, is once you start one, then we've got side effects, here comes the other, and here comes the other. And there's a lot of things that we can do that I go through and beyond the pill that, like, if you're on birth control now, and here's the thing that I really aim to do in my book, and if I did my job right, you will not feel afraid the entire time through it. You'll have moments where you're like, oh my God. Trust me, I've been there when I'm reading the research. But I go problem, solution, problem, solution. So if I present you with a problem, we've got immediate solutions following it up. Because I hate reading 200 pages of the book, of a book, and having the bejesus scared out of me, and then being like, and now you need to read another 100 pages to know what to do. And I'm like, my publisher, so I designed the book so it's like, you take a quiz in chapter 1 to identify your hormone imbalance, and then immediately it's like, just go to this page and start this protocol now. You can read it from front to back, but it's also designed to get in and get out.
Oh, cool.
And my publishers, who are always looking out for the reader experience, and of course, like, they're literary peeps. They want you to read the whole book, and they're like, well, like, you know, we want women to read the whole book and for it to be a journey. And I'm like, look, if you have estrogen dominance, you are irritable, you are inflamed, like, you ain't feeling right. I tell you have estrogen dominance. Now read 200 pages and I'll give you the
Let me tell you my story.
And I'm like, they will rip the book in half. They will curse my name. They will probably, like, hire a witch to, like, hex me and, like, throw the book across the room. And so I'm very much about, like, if I present you a problem, we go immediately into solutions. So in the Metabolic Mayhem chapter, we talk about how to drop inflammation, like bringing turmeric on board. It affects the NF-kappa B pathway. It supports phase 2 liver detoxification. It's been shown to be helpful for brain health. It's great for your gut health. You can grate it straight, so like a grater, straight into, like, I love turmeric eggs. That's my favorite. I just grate it straight into the pan.
Oh, good.
Then you get fibers. Those feed the microbiome. That's the other thing, like eating more vegetables. You feed the microbiome, which is reinforcing the terrain. Those little gut bugs help you get your estrogen out. So you want them working optimally. If they're not, you can actually have estrogen dominance. So, you know, in that, with the Metabolic Mayhem, if you're listening to this now and you're like, oh my God, I'm going to die. No. Get beyond the pill, check out the lab test, do the quizzes in there for family history. Like, are you at risk for a stroke? Are you at risk for a heart attack? I even present in there what it looks like for a woman to have a heart attack, because we die at higher rates than men do from heart attacks because we're dismissed, because we don't present the same way. So often we get told things like, you're just stressed out. You need to go take a yoga class, and then you go home and you die. And that's lame. So I wanted women to know.
That's a great voice.
You like that? I don't know what it is. Okay.
Nails the yogi right there.
So I actually worked my way through college as a yoga instructor, a group fitness instructor. But also there's something about these mics. I call these, like, sexy mics, where it's just like, you sound so smooth. Yeah, it makes me want to talk that way. Slow jams. Yeah, totally. I secretly always wanted to be a DJ, so this is like my opportunity right now.
Yeah, you're natural.
Busting out LL Cool J, giving the sexy voice talk.
So, Dr. Brighten, what sent you down this path? Like, what made you even want to get into this field? Like, how did you get into this?
Oh yeah, you know what's crazy is I was going to be a gut doc, because as a kid I had significant gastrointestinal issues. In fact, I was diagnosed with inflammation in my stomach when I was very young, and I struggled for about 10 years, and doctors couldn't figure out what was wrong with me. And I was on PPIs before they were actually ever tested in kids, like all kinds of stuff that I'm like, oh Lord. And you know, it finally got to the point where doctors were giving up on me, and they were like, yeah, no, you know, you don't, we think that you're attention seeking, like you don't actually have anything going on. And it was when H. pylori was discovered and finally the research made it into medical practices that a doctor said to me, you know, there's this new bacteria, like we should test you for it. And there it was. And so with that, once I was treated, I was like, well, should I change my diet? And he was like, no, don't worry about that. That's how old I am, you guys. And so with that, I did end up changing my diet. That's how I got into nutrition. I was like, wait, if I don't eat a bunch of refined carbs with like drinking orange juice and, you know, having tomato sauce and all of that, like I don't actually have heartburn. So like I can actually modify my diet, stop eating crap. What a novel idea, which actually is an acronym. And that stands for things that cause heartburn. But, and that propelled me into nutrition. And it was once I got into, so I was actually going to go get my PhD at Davis. I had a full ride scholarship. I was going to be a researcher until I realized that like I very much wanted to make sure that stuff was getting into people's hands real time, not like decades of us researching and then begging medical professionals to actually like look at their research or get it presented at a conference. So when I was in naturopathic school, I was still on the pill. And I made an observation early on that most of women's health is done to them, not with them. Like they're not an active participant. It's just like, and you guys have never had this experience, but it's just, let me just tell you how fun it is to be naked from the waist down, laying on a table and someone smacks your butt and says, scoot down, scoot down, scoot down while your feet are in stirrups. And then here comes this metal speculum. It is not fun. Like nobody wants anything to do with that. And what makes that experience so bad is that you're just like, it's just like your body is in the way. Like they're just trying to get at things instead of explaining things to you and working with you. And there's a lot of really great doctors out there who are the ones who showed me that like there's a different way. And it was so different from my experience of going to the gynecologist and how I was being taught. So that propelled me into women's health. And in my first year of school is the very first time, this is like why the book has a whole chapter on the lowdown on your hormones, how your menstrual cycle works, all of this, is because it wasn't until my first year of medical school I actually understood how my menstrual cycle worked and that I could only get pregnant one day out of the month. Like you shouldn't have to go to medical school to know how your body works. Like that was something. And then I was pissed because I was like, I've been popping this pill every single day. And yet I'm only fertile one day out of the month, which is, you know, to your point of like, what are alternatives? Fertility awareness method can be one alternative. And I was actually blown away when I got into the research because I was taught and then I perpetuated this myth that like FAM was just not going to work. Like it didn't work. And it's like, haha, you're going to get pregnant and the bad jokes that go with that. When you get into research, you're like, oh snap, it's like 99% effective when done perfectly, which is the same as birth control pills. And the pill is actually only 91% effective with typical use, which is how women tend to use it. Those were big ahas for me. But with this, when I kicked the pill, when I finally decided to ditch it, I just stopped. And for the first time in my life, I lost my period altogether, which was a shock for me. I had doomsday periods that I counted down on the calendar because they were so heavy and so painful that I was like, my life's going to be ruined one day out of the month. So I knew that they came regularly. And I had about 3 years of consistent periods, started the pill, 10 years later, come off, lose my period altogether. And I got cystic acne, and I'd not had acne issues before. And I had like a beard of cystic acne and acne on my, like, the post-pill acne is not just on your face. It's like chest knee, back knee, neck knee, butt knee, like it is everywhere. And when I went to my doctor, he was like, this is just you. I've never seen this before. And I was like, I think it's because I stopped birth control. He's like, no, it's because you've had PCOS all along. You'll read about post-pill PCOS in my book. So that, you know, I had a nutritional biochemistry background and concurrently studied clinical nutrition. So we are taught how to use food as medicine and like, okay, if you have this going on, like here's what you can eat. And in, you know, naturopathic medical school, they're like, here's what to eat at this time of your menstrual cycle. And here's like what you really need to like, you know, fuel, like to bring down prostaglandins, which by the way, ladies, prostaglandins, hormone-like substances that help contract the uterus so that you shed the endometrial lining. That is your period. And guess what? A lot of us start birth control like me because of it. And it can be easily corrected with omega-3 fatty acids and magnesium.
Wow.
And so it's usually a sign that something else is going on. So, I mean, I was really grateful to have the pill and shut all that business down. However, when I came off of it, having all these issues, I thought I was a freak. And then I didn't want to talk about it. I didn't want to talk about it with anyone. And then when I finally got my period back, and you'll read about this in my book, I bled through my chair in medical school. And you'd think that wouldn't suck because you're like, I'm in a room with future doctors. And I was like, I feel like I'm 14 in Mr. Atkins' class. Mr. Atkins, if you're listening, that's why I didn't get up that day and leave class because it happened. And I was like, somebody give me a sweatshirt. Now, thank God it was the 90s and wearing a sweatshirt around your waist was like a cool thing to do. I at least had my period then. Yay. So yeah, with that, I got my period back. I cleared my cystic acne. And then when I got into clinical practice, I came to understand that I wasn't the only one. the majority of women do struggle in some way to come off of hormonal birth control. And why wouldn't you? This shuts down an entire system of your body. It impacts your gut and your brain and your liver and your skin and your vagina and like all of these things. So why wouldn't you struggle? So that, that really was like my origin story in that. And yet really what it was is my patients, and like give it up for them because they trusted me. The protocols that are in Beyond the Pill, those were developed one-on-one in my practice with my patients who charted their data and brought it back to me. Again, I'm a scientist first. So I'm like, this is my hypothesis. Let's test it. Let's measure it. Is it true? Is it true for you? So working one-on-one with patients. And I got the reputation of being the doctor who believed women's birth control stories, which was crazy to me.
Crazy that there's a market for that. Right?
This the first time I was on the phone and they're like, okay, so I heard you're the doctor who believes birth control stories. And if that's true, I want to come see you. And I'm like, what are you talking? Of course I believe your story. Like what? And this was a woman who had an IUD placed, and she, after having a baby, and she developed, and it was some time later after having a baby, and she developed panic attacks. She didn't feel like herself. I hear this a lot with the IUD. Wow. Women, they're like, I got it taken out. And oh my God, like a week later, I'm like myself, and like the heavens parted and everything is so clear,
like
and I didn't feel like crazy. So disconnected. Yeah, well, because we vilified estrogen for a long time of like that synthetic estrogen is the troublemaker, but as we've come to understand the research, that synthetic progestin, which by the way, ladies, you make progesterone. It is the good stuff. Only Mama Nature and you make it. Humans in the lab make progestin, and while progesterone helps with neuroplasticity, it stimulates GABA receptors in the brain to make you feel chilled out and calm. It helps you have easier periods. You like people a whole lot more when your progesterone's right. Progestin doesn't have those benefits. And in fact, progesterone will help you lose water leading up to your period. So if you get puffy hands and feet, that might be because you have too much estrogen relative to your progesterone. If you're on birth control, it's because you don't have any progesterone. You have this progestin, and it's not a diuretic. It's not the same thing. So that's that water weight gain that we talked about. Now, the other thing is that the progestin alters how immune cells function in the brain. So they make more free radicals. Well, at the same time, birth control depletes your antioxidants to protect against free radicals. So it's a lot of stuff going on there. And what's so fascinating to me is how many women came to my office telling the same stories. They didn't know each other. They weren't on forums together, sharing stories. Same story. Over and over and over. And yet their doctor's like, no, there's no research to support what you're saying. And it's like, well, who wants to fund that? Yeah. Who wants to fund research? It's like, oh, those side effects are way worse than we ever thought. Like,
what are some of those stories from, like, so you mentioned IUD, but also like the shot and the pill. Like, are there differences between those?
So, those all have progestin in them. What's interesting is that the research that's been coming out of Denmark has shown us that, yes, the estrogen, the synthetic estrogen can be bad for the brain, but progestin seems to be a whole lot worse with the mood correlation. We're not at a point with the research to be able to say causation, but we've got big enough studies now, and we've got enough women. I mean, it's in the package insert. We've been complaining about it since the introduction of hormonal birth control, and we know what was really cool is that, what wasn't cool is that the Danish study came out in 2016, and the number of male doctors and scientists who lined up to say that's not real, to be like, no, that doesn't happen. Oh, that's just correlation. Like, these women have something else going on. Like, I wondered if even for a minute, if they ever thought they would say that to their sister or their mother or another woman in their life, because that is a painful thing to have someone in a position of authority dismiss the research that's finally validated what you knew to be true all along. Like, that is painful.
That's terrible.
Yeah. But with that study showed us that the progestin only, so we see that with the depot shot, the IUDs, the mini pill, that they don't fare any better. And actually, it can be a lot worse in terms of the mood effects. So you're at a higher risk of being prescribed an antidepressant when you're on hormonal birth control. And then in addition to that, I've seen women who get the depot shot and they end up finding that like they're binge drinking, like they've never been a drinker. Whoa. And now they're binge drinking.
Is that for the GABA effects of the alcohol?
So there is alterations in like dopamine happening in the brain, but this comes down to the risk-taking behavior that we don't pump the brakes on as much. We also don't pick up on subtle social cues as well, which is really funny because this study just recently came out and it was like, Oh, okay. So they're like women, so we're animals, okay? We've acknowledged that. And how do animals survive? Like based on instinct, like there's that sixth sense kind of thing going on. And really it's that, maybe it is just intuition and something we can't name and science doesn't have the tools to study yet. But it's also likely that stuff's running in your subconscious that your forebrain's like, I don't even need to know about that. Like just handle it. Like breathing happens, heartbeats happens. You don't have to think about it. And it may very well be that like avoiding, like when a woman's walking down the street and she sees a guy, like, and she decides to cross the street, she doesn't know why, but something told her it's time to cross the street.
There's subtle cues that we're not even aware of.
Super subtle cues. And so with that, the researchers are like, it's not that significant because if it was, we would have noticed it by now. And I'm like, you're so cocky. I can't believe you wrote that. Like you said that. Like, and the thing is that it's very different to be a woman in this world in terms of the threat of harm that can come to us. Like I in particular, I just think we were talking about Game of Thrones. If you are Brienne of Tar, then it's no big deal for you. But like we're usually tinier, we're smaller, and we can be at higher threat in our environment. So all of these things keep us safe. And so I actually did a book signing in New York. I have to say, shout out to Ricky Lake and Abby Epstein who hosted this for me. They're awesome and thank you. But the thing ended with me talking about this study and going into this book about the gift of fear and how women's instincts like keep them from getting raped and how we actually, we pick up on these little things that we then have society's influence telling us, don't be a bitch. You should smile. You should always be nice. Ignore that. You're just being unkind. Women shouldn't be unkind and all of that. And it's like, nope, that's actually keeping you safe. If some guy walks up to you in the grocery store parking lot at night and no one else is around and he's like, let me unload the groceries and your answer is no. And he's like, oh, what? You think you're too good? And you say no again because there was something there saving you. But I ended the whole thing on this like rape story that happens there. Every woman should read The Gift of Fear. I read it when I think I was like 15 or something. That'll scare you. That's scarier than my book. But it also really taught me that like these subtle cues are so important. So that was the first thing that came to my mind when the study came up. But that is a horrible way to end a book signing at like 10 o'clock at night in New York. I just want to say that. That's why I brought that up. I'm like, if you were there, I apologize.
Well, Dr. Brighten, another thing that I think that we've, the stereotypical symptoms of things like PMS, right? Like feeling a particular way, maybe irritability, cravings or whatever. Are those all subtle instincts that benefit us? In other words, we tend to try to get rid of them by taking the pill. Yeah. Are there benefits to having those feelings? And is there a reason for them?
Yeah, totally. So in the book, I talk about, so in chapter 4 of my book, which is like the decoder ring out of the Cracker Jack box. I'm just dating myself over and over and over here.
I'm getting them all, don't worry.
Okay, good. But basically, like when you get your period, you should get chapter 4 of this book so that you understand if you have this sign and symptom, here's the labs you should test. This is what it might mean. So you can go talk to your doctor about it. And here's what to do right now so you feel better. And so these symptoms are your body's way of communicating to you that something is going on. The irregular period, for example, it might be that hypothyroidism. It might be polycystic ovarian syndrome. It might be a prolactinoma, which is a benign brain tumor in your brain. Like, well, how many times can I say brain in one sentence? But, that could be what's going on. So we have to investigate. Your symptoms are an opportunity and an invitation to heal. And we have to understand that the way disease develops is that it's like it always starts with the subtle stuff you'll just deal with that you're like, I can put up with this. I can put up with this until you can't put up with it. And like these things progress and you as a woman, you know your body so well. This is why in my book, I teach you how to track your data because the reality is you will know something's wrong before your labs show something's wrong. Like it takes a while for those labs to show gross variations. And especially if we're using the conventional reference ranges, which are generally based on sick populations. So it's not a marker of healthy people. In fact, I advocate that every person, when they are feeling awesome, should get their lab testing done and get their baseline test. So when they don't feel awesome, they know they're normal. They can compare and they can go back. And that can actually help you get attention from your doctor a whole lot faster. So, I make this analogy in the book about like, when you post-birth control syndrome, the collection of signs and symptoms that come on after women stop hormonal
Did you
birth
come
control.
up with that term, by the way?
I came up with it. Other people have been saying it as well. And so it's something like, I don't know. I have people who are like, no, obviously they're the first person that said it. And I'm always like, yeah, but I feel like everybody was observing it. We didn't have language around it at the same time. Because whenever I bring it up with clinicians who pay attention and listen to women's stories, they're like, oh my God, that's what I've been seeing. That's what it is. So, with that coming up, I say, what post-birth control syndrome is kind of like is that your body was bound and gagged and thrown in the back of a trunk. And it had something to say for a long time, but it was held hostage. And because birth control numbed out and shut down, I have a good friend, Dr. Brighten, who calls it chemical castration, which is essentially what it is. It's a temporary one, and it sounds harsh, but that's the real talk. And so when you pop that trunk and you rip the duct tape off your body's mouth, your body's going to start yelling at you and be like, I need you to pay attention right now. It's not because this narrative we've got is that being a woman is inherently awful. Your body's always betraying you. Hormones are the worst. No, hormones give you superpowers, and that's why your brain works a little bit better than the male brain in some regards. Not because you're better, just because you're different. But with that can be what's going on. But we're told those symptoms are bad and we have to suppress it. And that's what pharmaceuticals do. And there's a time and a place for it, but they strong arm your body into submission. Whereas working with your body naturally, that's going to take a lot more time, and it's more of a dance, and you have to orchestrate that. And so understand that if you suppress anything, and that can be part of post-birth control syndrome, is it masked something that was going on and allowed it to fester and progress. And then you come off of birth control and your body finally has the opportunity to present it to you, which is usually when doctors are like, do you want to have a baby? Yes or no? You say no. Great, go back on birth control and we'll discuss it when you want to have a baby. Whether or not you want to procreate doesn't mean that you should, get that's a choice that's an aside of your health. You should get the best care possible regardless of whether you want to make a baby or not.
Are there some birth control pills that are better than others? If women right now are like, I need to take the pill anyway. Which one? Are there some that are better?
So, in general, I wouldn't say there's definitely ones that are better. But what I would say is that if you already are at risk for stroke or heart attack, staying away from the family of progestins called drospirenone, the Yasmin, Ocella.
Okay.
When those guys stepped on the scene is where we saw the heart attack and stroke risk really climb. And it's because they're potassium sparing. So this is also an issue if you are popping ibuprofen, because spoiler alert, it doesn't always take away period pain to start the pill. And so if you're taking that and you're taking ibuprofen, say you have endometriosis, now you're on 2 potassium sparing drugs. Get a comp metabolic panel, or at the very least get your electrolytes drawn, and you can see where your potassium's at and understand what your risk is for that.
Interesting. What are some of the strategies? Let's say someone gets off the pill, they're noticing some of these symptoms. What are some of the strategies that you employ to help women get back into just regular health, better health?
Yeah, so I have a ton of recipes in the book, and I'm always a food first person. So we have a whole 30-day protocol, and the first thing is we jump right into liver detox support. This is not, a lot of people I see out there are like, oh, you have to detox those hormones out, otherwise your body can't get them out. No, your body can do that, but it's kind of like we tied a hand behind your back, and asked you to go play a baseball game or something. And that's what's going on with liver detox and gut detox and what we call the emunctories, your ways to get waste out. And so we jump right into how can we support liver detoxification and gut moving things out, so pooping every day. And we do that in the first 14 days. That's the thing I see will move the needle really fast in terms of not having acne like you're a teenager. Because is there anything worse when you're 40 and you look like you're 14? That's not cool. And you just you got wrinkles and you got acne. That is not fair. You could be able to trade that. Be like, I'll take the acne and just make the wrinkles go away. It's lame. So we go right into that. We talked about liver detox, and we've talked about nutrient depletions that happen and having to replenish nutrient stores. So the dietary protocol in there is designed to do that and designed to help you rebuild your hormones. So you start making your own hormones. And Chapter 1 of the book has a hormone quiz. You've got to understand your hormone imbalance, because it may be rooted in adrenal health. It might be what's going on with your thyroid. It might be insulin, progesterone, testosterone. It could be any one of those is the key troublemaker, and it's going to look a little different in terms of diet, lifestyle, and supplement protocols. And so I guide you in that, and I give you a whole sample day of how do you actually do this? Because it's a lot to switch. If you're I don't even eat vegetables, and now she wants me to eat 6 to 9 servings a day. by the way, if that's you, just start with 1 serving a day for a week and then increase over time. Like, go slow. Slow and steady always wins the race on behavioral change. Now, we've also got to reverse that metabolic mayhem. So we've got to drop inflammation. And I really encourage women, get a hemoglobin A1C. It's an average of what your blood sugar looked like in the last 3 months. And it's a lot more sensitive in picking things up than just a glucose alone. A fasting glucose. Sometimes I see patients who have elevated fasting glucose and I'm like, how do you do with blood draws? And they're like, I hated it. And I sat there for an hour and I was super stressed out to get it done. And I'm like, yeah. And you spiked cortisol and cortisol hit your liver and your liver gave up the glycogen into glucose and now your glucose went up. So this is a one snapshot in time of somebody having an appropriate stress response. That's what your body should do. But we should also get a fasting insulin and a C-reactive protein. Now, fasting insulin, because if your insulin is going up like above 6, that's just trouble coming down the pipeline. And then the CRP, the C-reactive protein, it's a marker of inflammation. It's been shown in studies that they measure women's blood. They put them on birth control, and some women have 3 times the increase of CRP. That's inflammation. That's inflammation that's affecting your brain, your cardiovascular system, your entire body. It's not a good thing. We know. You want to get a chronic disease? Get inflamed. So that's the way that you get there. So with that, we have to look at those pieces and we have to look at how can we eat to lower inflammation? What things can we bring on to help sensitize our cells? If we've got insulin resistance, then we're going to see thyroid resistance, cortisol resistance. Like if your cells are inflamed, you can't dock hormones, so you can't use them. This is why women will say, my thyroid panel is normal. Everything is normal. And you look at it and it is, but they're like, I still feel hypothyroid. Well, we don't have a great way to test cellular resistance. And it's likely what's going on because we look at where your inflammatory proteins are.
In other words, you're just not using it.
Exactly. You can't use it. It's hormones be so tricky. So so with all of that, now the other thing, and what I've just gone through is like the 5 fundamentals of the Brighten protocol. And the last one is your gut. And it's so funny to me how many people will be like, I'm really surprised that like I got this book and then you like went into liver health and gut health and all of that. And I'm like, yes, because if those aren't right, your hormones are never going to be right. So your gut, which houses all these wonderful critters who do so much for you. They also help with processing estrogen. But if you've got the wrong guys growing there, they'll make beta-glucuronidase, which reactivates estrogen, puts it back into circulation.
Wow.
Now your liver's like, WTF, mate. Like, I just got all that out, and now I got to do it again.
Oh, wow.
And so that can be one way to develop estrogen dominance. Same if like you're not moving your bowels every day. Yes, you need to poop every day. It is the only way to really get that estrogen out. It's one of the main ways that we get a lot of waste out. And so with that, we've got to not only replenish the microbiome, so we've killed some of them being on birth control. So that's why if you're on it, please take a probiotic and eat prebiotic foods and probiotic rich foods. So getting things like sauerkraut coming in, kefir, kimchi, making sure you're eating artichokes, and everything I really go through in Beyond the Pill is going to help you. Whoa!
Hey there, I got excited.
Get so excited about the pooping.
Sorry, I'll
You
calm
said
down.
poop.
She does know us really well. Yikes.
Oh my God. So this week I have to share that I was laughing about something and my husband's like, I wonder how many people would ever guess that you have the humor of like a 14-year-old boy. And I'm like, I know. It's why I birthed a man. Like that's what happened there. Cause he's like makes a fart joke or he comes over and like, yeah, this shouldn't happen. And he farts on me. That's like something he's really into. And I have to run out of the room because I laugh so hard because he does these sneak attack. And I'm also like, good on you. I'm kind of proud of you. Like how you're so sneaky. Like I didn't even see it coming. Or he'll make a joke and my husband's like, that's so inappropriate. You have to stop laughing. I'm like in tears on the ground. And he's like, my husband's just
that's awesome.
Dude, you're like,
You talked about endometriosis.
Yeah.
My sister has endo. And maybe you can school me a little bit on that because I didn't even know about it until my sister. In fact, I feel like a lot of people don't know a lot about endo. And with your nutritional background and your food first attitude, what are some things that I should know or she should know about that?
Totally. So first thing, 1 in 10 women have endometriosis, and it's one of the biggest underfunded areas of nutrition of women's health. And it's really It's sad. And there's so much we don't know about endometriosis just from a lack of asking. It so breaks my heart. So with endometriosis, we understand that it's likely looking more like an autoimmune condition. Right. So in Beyond the Pill, you'll get into the gut check chapter. There's an autoimmune protocol because, as I said, birth control comes with autoimmune disease. Who gets autoimmune disease at the highest rate? Women do. So that's one thing we start to look at with women with endometriosis is gut health. Do you have leaky gut? What's growing in your gut? Because we know that certain organisms can be inflammatory, but can also trigger autoimmunity. Now, the other thing with endometriosis is that it's implantation. So people who are listening, this is like the worst period of your life. It's not like, oh, I have a bad period. It is like for some women have explained it of like, it's like someone exploded shrapnel inside me. Like it hurts so bad. They are vomiting. It impacts their activities of daily living, which in medicine is a really big deal. Anything that impacts your ADLs, that is like slow the roll. We've got to do something about that because that impacts your quality of life. And if you're a woman with chronic disease or you're a woman with chronic pain specifically, you're at a much higher rate of being dismissed and receiving inadequate care. Yeah. This is in the research.
This was her for a long time.
Yeah.
Yeah.
Like, oh, you're just having painful periods. Yeah. Welcome to womanhood. This is just the way it is. Understand that it's common to have period problems, PMS, and all of this, but it's not normal. And why does your doctor think it's normal? Because who goes to the doctor? Sick people who need help. Mm-hmm. So it's all they see all day, every day. And they're like, oh, this is normal. This is the way it is. It's not. It's not normal, and we need to be asking what's going on. So with that, these women get endometrial implants. The endometrium is the lining of your uterus, and these implants can end up anywhere in the bowels. So now that's pain when you poop, on the bladder, pain when you pee. It can end up in your actual abdominal cavity, and so it's not exactly like the endometrial tissue. So we used to think like, oh, it's just these endometrial implants. Yes, but it's a little more fibrous. There's a little more cysts in it. So something's different about it as well. And that's where we need to investigate a little bit more. But these tissues can be stimulated by estrogen. And estrogen will cause those tissues to proliferate. Then when your period's going to come, your hormones drop, it triggers a bleed. You could be having bleeding in different places of your body, which is it's going to get your immune system hot and bothered. And that's going to be painful as well. So we're going to have that inflammation component. So this is where environmental toxins, probably playing a big role in this, estrogen dominance, we've got to get estrogen in check, as we do with all autoimmune disease, because estrogen is a big player in your immune system. And it doesn't mean get rid of all the estrogen, because without that, we can't actually get our hormones up get our immune system balanced in the right way. Now, the other thing that I talk about in my book, which is like, I had to say, I did this virtual book club where we went through every chapter of the book. And when we got to the getting your libido back chapter, there were so many women who are like, my husband is right now looking over my shoulder, was like waiting for this chapter, just like waiting for this. And when I went through the top 10 health benefits of orgasms and how having regular sexual activity, defined as weekly sexual activity, actually modulates the immune system, can help with lowering pain, lowering inflammation, and regulating your menstrual cycle as well. All the men were like, oh my God, see?
Those are great fun facts.
Yeah, it's totally, but it's also something like, yeah, but you got to do your work. Like, and it can't be like what you see on the movies where it's like, we kissed and then she just had an orgasm. Women aren't wired that way. Don't work that way. Like that it should make it more fun.
Speak for yourself.
You're like, I just look at her across the room. It's done. It's over.
Dr. Brighten, I'm by no means an expert in hormones or hormone balance, but I did train a lot of clients. And when I would get female clients who would get off birth control and talk about some of the stuff that you're talking about now, I had no idea what to do other than apply my expertise, which was exercise. And the way that I would train them, I was very careful with intensity. I would not have them do lots of circuits and high-intensity cardio workouts and beat themselves up. We would do traditional resistance training once, twice a week, get stronger. I would have them do mobility work and recuperative work. And that seemed to work very, very well. And that's become my protocol now whenever I get people in that situation. Was that the right approach?
Yeah. And so I like that you bring up the exercise piece, and it does lend itself to like the endo talk as well, because exercise can really help. Now, you can actually work with a woman's menstrual cycle to help her have even more gains.
Oh, really?
Yeah, there are women who, I can't even tell you how many times I have a patient. So I used to be a spin instructor. I'll own that first. So I'm not judging anybody. But, spin's designed to be a 40-minute class from start to finish. And yet I was in gyms. Oh, my God. New Year's Day, they'd always have me teach a 2-hour spin class.
Oh, wow.
Like, you want to talk about metabolic mayhem? I killed some people's adrenals. Like, that was not okay. But what did I know? I was like, I was just a college kid trying to make some money. So with that, that's something that's stressful, right? We have to look at if a woman is not ovulating, what would keep us from ovulating? One thing is the signal from the environment that it's not safe.
Right.
So
more stress.
Exactly. Your body will choose survival over procreation, as it should, because it's in it to win it with you for the long run. And also a baby, if your body's not evolved with like iPhones, okay? Like we're just catching on to all of this. And so your body doesn't know that there's not a lion or tiger. And it's just like babies are noisy. If you're pregnant, you can't move. Like we're going to have a predator on us. So like we're going to just shut it down. So with that, when we look at like women coming off of birth control and they're like, oh, I just want to lose the weight. And sometimes they go really, really intense.
Too intense.
Intense. Yeah. That's something where now their body's getting the stress signal. So, it's always something I have to frame to people. Just because something's a good thing doesn't mean more of it's a better thing. Like we have to really respect our body and where we're at. So dialing down the intensity can really help reestablish brain-ovarian connection. So the brain signals to the ovaries rather than signaling to the adrenals, make cortisol shut down the progesterone, the ovulation mechanism, which by the way, without ovulation, you don't get progesterone. That's why ovulation is so important. So with that, I think that's brilliant to have dialed it back. The other thing is like getting all TMI, because that shouldn't even be a thing, TMI. Like it just like we're humans. Like it's always when it's like when people are like, oh, I don't want to talk about my poop, it's TMI, and like I feel ashamed. I'm like, would you shame a dog that you see pooping? Like you wouldn't do that because you're like, that's what you do. That's what's just like normal. That's
everybody
what
poops.
Everybody poops. There's a book on that, which is silly. We had to have a book on it, but that shows you like what prudes we've been, I guess.
It's like amazing.
Yeah. So with your menstrual cycle, here's how it works. When our period's going to come, what happens is we drop estrogen and progesterone. That drop signals the body there's no baby, shed the endometrium. You're shedding an entire organ you just grew. So if you feel like you are a little bit tired leading up to that or tired on your period and you need to dial back, that's not abnormal. But we live in this like male-driven society, and this is not man-shaming or anything, but just this idea of like you guys are like the same all of the time. And so we think we've got to be the same. And if we're falling behind, like we got to push harder, and there's no space in society to really be like, no, I actually need a home day and a mental health day, and I'm going to like stay home because I'm shedding an entire organ that I grew over a month's time. So with that, that's a really good time to dial back. Maybe it's yin yoga. Maybe you're decreasing the weights, but you're still doing weights. You might do
mobility
work, or you might be doing like lower weight but higher amount of reps if that feels good to you. And then as you're coming off of your period, your estrogen's starting to rise, and then roughly around day 10ish or so, testosterone's going to start spiking. These are sprint. Go. Like you can do that. That's a great time to get your, like you want to lift heavier, go heavier. That's a great time to do it. As you're leading into ovulation, you're going to still feel like those, those that you are like, oh man, I have so much energy. Like women might even notice this subtle thing of like, oh, I'm walking up the stairs like on my period, and I'm like, oh, I'm taking my time. And then like you're jumping up 2 sets of stairs, like while you're like, you're ovulating, you're like, I can go, I feel amazing. And then after ovulation, as your progesterone rises, like we can get stimulations to the connective tissue that we want to be a little more conscious of, like how we are moving our body. And maybe we want to do strength training that we have a spotter or being braced with that. And with that, we may even want to do some Pilates and bring some Pilates into the mix, or, body weight training in that way. And then as you creep closer to your period, again, if you feel your energy come down, respect that. If you feel like, man, I'm going anaerobic, like every time I like go to do something, I'm just panting, I can't even have a conversation. Well, now you're burning glycogen. You're not burning, the fat that you want to be burning. As you guys know, that fat burns in oxygenated fire. So with that though, don't get on yourself. Be like, oh, then maybe this is an opportunity to do something different, to really pull back. And what's really cool is that when we are on our period and, typically about day 2-ish, day 3 of our period, our brain hormones, our estrogen is starting to rise. So we are then, even while you're still bleeding, you're focusing on getting that next egg ready. Again, why ovulation is really the focus there. But your corpus callosum, which is the center of your brain, connects your lobes so much better. So doing cross-body action in this time can actually help you dissipate stress.
And this is right before ovulation?
This is, on your period. Leading up to ovulation.
Excellent.
Yeah. So this is where like walking can actually be tremendously beneficial in decreasing your stress, but also, just making you feel like you're on your game. And this is a great time to start like analyzing life and looking at like, what do I need? Like, what do I really want? What do I want to really get rid of? And so there's different ways throughout our cycle that our brain works differently. And there's been brilliant psychologists and psychiatrists writing about this information with regards to our menstrual cycle. And there's a new book that's going to be coming out later talking even more in depth about this that I can't share about because I've been privileged to read it before it actually comes out. It is really good. And I love all this and it fascinates me. And it's a way to actually work with a woman's body. Now, why I brought out the spin instructor thing is because how many patients I've had when I'm like, I want you to do a little bit less. Like, I want you to do a little bit less, and we're actually going to do exercise to work with your menstrual cycle. And they're like, oh my God, this month I've already lost, I was losing 2 to 3 pounds a week, if that's what they needed to use, which is, 3 pounds is kind of max in terms of sustainable weight loss, by doing seemingly less. And how many athletes I've had that are like, oh my God, you're never going to believe my time swimming or this or that, because I actually worked with my menstrual cycle and it's almost like your menstrual cycle builds in the recovery phase.
Totally.
It makes you focus on these other things.
Totally. We notice this as trainers all the time. And if you're pushing your body when it doesn't want to be pushed, it's going to want to hold on to insurance, which is body fat. So trying to lose body fat during a period of time when your body's feeling stressed out.
Well, we've
very
been coined as Team No Sweat because we're constantly cautioning people that are listening. Because in my experience, the people that tend to gravitate towards this type of training, the high intensity, the spin class, are the ones that shouldn't be doing it.
Yeah, they're the A-types. That's me right here.
It's the
Hands
A-types.
up.
We call them cortisol junkies.
Yeah, totally.
It's I'm not trying to demonize spin. I'm not trying to demonize these ways of training, but in my experience of training hundreds, even thousands between the three of us of people, those are the ones that gravitate toward it.
Totally. And there's those people who thrive being marathon runners, which I'm going to share with you that in the Portland Marathon, I actually worked in the medic tent, and that was the very first and last time I ever considered running a marathon. You don't want to be the first person in. You know what the first person to cross the line does? They run straight into the medic tent, and then they get their blood pressure taken while they're also getting an IV bag put in. And I was like, when I was seeing that and people vomiting and everything and people being just taken to the ER, and I'm like, this is not for me, shut it down. But there are some people who totally thrive with that kind of exercise. They probably have different genes. They're wired a little bit differently than us. And I also wonder, oh my God, it's so Game of Thrones season. I'm not going to give any spoilers because I don't want to be that person. But winter it came, okay? It came. And the only people who survived, I said this to people, I'm like, there's this thing called an MAO gene that processes your catecholamines. I actually have a mutation in this, which it's called the warrior gene, which means that if I get stressed out, I don't clear my epi, norepi, my freak out hormones from my brain. And this, evolutionary speaking, why we think it existed was because if somebody attacked the tribe, you could go can't stop, won't stop until everybody's dead or they're far enough away from your tribe. Oh, wow. So when you're watching Game of Thrones and the Night King is there, I want you to identify who likely had an MAO defect because they're the only ones that lived to be able to battle that long. And so these are people who may gravitate, and this is something if you're this person, you will have a propensity towards anxiety or feeling like you want to rage out. Jump squats are some of the best medicine for that, because we just have to go through okay, so if your body's doing this, what does your body want? Well, it thinks you need to flight or freeze or, fight somebody. And so give it what it wants, move big muscles. And so this is something where I will tell women take off your high heels, go close the blinds in your office or whatever, do some lunges, do some jump squats, like do something that gets your heart rate up and moves the big muscles so that your body got what it needed. And it's like, great, I can chew through those catecholamines. I can work on all of that. But it may very well be too that some of these A-type people, like what else are they able to do? They're the ones that like, I mean, I've seen these lawyers in the Bay Area where they're like, I only sleep 5 hours and I go to work and I sleep there and they go. And I'm like, and then people like shame them for that behavior. But I'm like, can I just like for a minute say like mad respect? Because a lot of people would die doing that. And like, there is something very special about you, but like, let's make sure you live long life. Like, let's work on that. So, there may be something about that causes us to gravitate towards that. But again, just because it's good, more doesn't make it better. And so we really have to pay attention to that. And that is something, circling back to endometriosis, that if you are overdoing it in any capacity of your life and you're signaling that stress response over and over, which can just be the way you talk to yourself, fascinating research that if you say mean things to yourself, yes, women, I'm talking to you because yes, I try to participate in this and I have to slow the roll in it as well. If you get in front of the mirror and you're like, you're fat, you're ugly, you're dumb, you don't do anything right, your inflammatory proteins go up. You become inflamed. If you get in front of the mirror and you're like, you're a rock star, you kick ass, you're doing the best you can, and like you forgive your past self and you just keep doing you, your inflammatory proteins drop. And they've compared it to meditation, and talking nice to yourself beats meditation in dropping. Now, you should probably still meditate, but because that's how you get there, to be like, oh, I'm conscious enough that I'm running these same negative thoughts. But any kind of thing that gives that stress response, that can compromise your progesterone. Now, in the case of endometriosis, we've got overstimulation of estrogen. Things are going to feel a whole lot worse.
And the irony of the negative self-talk is if you saw a person speaking negatively to another person constantly, we would all be like, that's terrible, stop doing that. But yet we do it to ourselves, and there's nobody we believe more physically than our own selves. Like you could be yelling at me and saying bad things to me, and I could believe you or not, but what I say is always true. Yeah. And so that negative self-talk is far worse than even someone else doing it to you.
Yeah, and I try to tell women, like talk to yourself like you're 3, because whatever's going on is probably something from that 3 to 5 year old range, that something happened and kind of got imprinted on you. My husband actually had this brilliant idea today. My child has PANDAS, which is a pediatric autoimmune disorder of the brain that he developed. It's very recent. It's only been like a handful of months that we've been dealing with this, and it's very difficult to navigate. And right now he's being really cool. But my husband and him, they just have this like friction, and I can see it. But like, then I try to frame it to my husband. He's like, I don't see it. He had this great idea. He's like, I'm going to wear the GoPro camera on my head today with our child, and I'm going to record his response and the things that I'm saying. And then that way I can truly mirror it back to me and see what's going on and try to impact. I was like, go you. Like, that's like, wow, amazing. And I thought about that. Like, wow, I was sitting on the plane and thinking, what if I was wearing a GoPro during the day when I like go into the bathroom or I go into the gym or like any of these things? Like, what would I say to, like, what would I see that I'm doing that I'm not even aware of? It's just a very interesting thing to think, like, if you're talking bad to yourself, maybe you need a GoPro on your head and be like, and watch it back and be like, oh my God, I'm so ashamed because there are things that we will say to ourselves that we would never say out loud to another human.
Or another person, yeah.
Oh, absolutely. And kids hear us say sometimes these things that we say to ourselves, and they internalize it. So.
Oh, yeah. Oh yeah, no, like trust. So like I totally own like body image issues. I think if you spend a decade working as a group fitness instructor, you're gonna have some body image issues because you stand in front of a room in front of everybody and like you're wearing tight clothes, like the whole works. But I just rolled back from living in Paris, and I will fully confess, the last week that we were living in Paris, I sent my husband out and I was like, you don't come back with less than 12 desserts. Like I have been awesome like this whole time, and I'm gonna eat 12 desserts, which I can't really do sugar. Like I like had like one bite of every single one. I was like, I'm out. I can't even do it. But with that, it's like, okay, so I'm holding some extra weight right now because I've been under tremendous stress with my son, a book coming out. I've had very little sleep. Like when he goes into, he's in a flare, like he'll sleep like 4 hours or less a night. It's interrupted. And so all of that, I'm like, okay, so like I want to get in front of the mirror and be like, oh, you're so fat. Why don't you just lose weight? What's wrong with you? Like, you're supposed to be this pillar of health. And I have to look and be like, Yeah, you have, like, if you were your patient, you'd be like, look at all this stuff that you have going on. Like,
Exactly.
of course, we're going to have a little more belly fat because our cortisol is elevated. That's what happens. Like, your butt, hips, and thighs, that's going to get a little more plump if, like, you're not getting your progesterone up. Progesterone helps with our metabolism. So without that, that can be a bit of an issue, and estrogen is stimulating those areas. I have hypothyroidism. I know that if my upper arms start getting a little bit jiggly, it's time to go do a thyroid test, because that can actually be a sign of hypothyroidism or even low testosterone. And so there's certain ways our hormones can show up in our body. And just to like hit this argument like right away is that I know they're all male doctors that I've seen out there saying, like, they make these like Willy Wonka like memes and like these really condescending things to women where they're like, tell me more about how your hormones are causing your weight. And it's not just that you're eating too much. And I'm like, oh, find you in a dark alley, I will. Like, for real. And I'm like, except that what do you do as a physician when a woman comes to you and says, everything is the same, and yet I'm having unexplained weight gain and I don't know why? You test her thyroid. That's a well-known like symptom of hypothyroidism. What if she's losing too much weight and she's like, I don't know why I'm losing all of this weight. I'm sweating all the time. I can't sleep at night.
Hyper.
You test her thyroid. And so this idea that like, oh, your hormones don't have any impact on your metabolism or any of that, it doesn't even make sense. I'm like, what about insulin? Like, what about that? That can also cause belly weight gain. If somebody's complaining about like, no matter what I do, my midsection is gaining weight, I'm like, let's check your cortisol versus cortisone, and let's check your insulin and make sure it's not an issue. Can it be that you're eating too much and not moving enough? Yes, it definitely can be. But like, the thing about health, I'm still like trying to squeeze my belly. It's hilarious. The thing about health though is like almost never one thing. Mm-hmm. It's usually a collection of things. And that is why I love being a root cause medicine doctor, is like, I'm a great problem solver. So I get to take all the puzzle pieces, put them all together, and paint a picture for that person to be like, hey, this is how you got here, and here's where you're going if we don't act now. So like, here's what we're going to do to reverse this. And in a lot of ways, it's just like, my job is just listening to all the data points they provide me to troubleshoot what is going on for them. And when it comes to your health, it's like reading a book that's too close to your face. You already know everything. You have all the data, but it's so close you can't navigate it. You can't read it. It's out of focus. So you need someone who can stand back and be like, oh, okay, here's what we need to do. It's your signs, your symptoms, how you feel living in your body, what you say is normal and not normal for you, that guides us in what lab testing we need to conduct next.
Well, this has been absolutely phenomenal. I have one more question for you, but I do want to comment on the hormone thing.
Yeah.
You know, they talk a lot about you need excess calories to gain weight, but your hormones determine a lot of times where that weight goes. Mm-hmm. So you could take like a male athlete, have him eat the same amount of food, give him testosterone, extra testosterone, and he'll get more muscle and less body fat. Those calories have been repartitioned from fat to muscle. And that's just one simple example that I know everybody can understand. Mm-hmm. One last question. You talked about, birth control methods that were not hormonal, like, testing when you're ovulating. What about the good old-fashioned pull-out method, if done properly? Is that a viable birth control method?
Good old
Sal's been pushing this for a long time.
4% failure rate when done correctly.
And
when I read that,
that's not bad.
My jaw dropped. But you gotta
do it correctly.
And that's here's what happens to some men. Not all men. Some men can be on their game. But that their hormones override their brain. So like having a logical thought.
Wait, you're saying that men's hormones overrides our brain?
I know. Imagine what a novel thought. I mean, yeah, there's some men that when people are like, they're cheaters, they're just a dog. And it's like, well, they're like, maybe they are. Or maybe their amygdala can't function and like they get flooded with hormones and then they're like, can't compute, must just follow like what my little brain is telling me and do that work. By the way, there's no actual brain, but there is a nervous system tissue there. So
the beginnings of a brain.
Yeah. Totally. So, the deal though with the pull-out method is what makes me uncomfortable is a woman can't control it.
Oh,
and she can't control it. And then there's also pre-ejaculate, or what people know more commonly as pre-cum. That does exist. There can be ejaculate before there's actually an orgasm. And if those swimmers be strong, they will find their way to an egg. Like, if he, is eating seafood and Brazil nuts and has his selenium and his glutathione's on point, then those guys are going to make it. Like, they will swim and they will make it.
I'm glad you said that, because I think the pull-out method.
What about combined with also knowing when she's ovulating and stuff, and actually planning not to have sex for those few days that she has a higher chance of being pregnant?
That's a great combination.
Yeah. So with fertility awareness method, there is a bigger window. So women can get pregnant for 24 hours. It's a 24-hour event with that egg. That sperm be tricky, and it can live like 5 or 6 days, which makes sense. I mean, there are other mammals in nature that actually go have sex, capture sperm, hang on to it for months until like they're in the right environment, and then get themselves pregnant. And so, again, we're animals. So with that sperm can live for a bit of time. And so that's why when you're doing fertility awareness method, the fertile window is more like a week. So it's like, you got 3 weeks, green light, go, and, 1 week out of the month, like, shut it down. And with that, women will often say, like, well, my partner doesn't want to use a barrier method. Okay, well, it's up to you if you want to risk the pull-out method. I present the science. I, as a physician, would never be like, this is a good method for that, just because that feels irresponsible. But I provide the education, and you can make a decision for yourself. I just was actually shocked. I had to put it in my book because I was like, whoa, wait, what? It's like 96% efficacy rate? Like, that's amazing. Like, I didn't even know that. Nobody taught me that in medical school, so that's cool.
Yeah.
Old school. I know, and people have so many names for it too, but so some people do use the pull-out method. I mean, that is a risk that you could become pregnant. Other people decide to engage in something else and spice it up in their bedroom. I've actually had women say to me, my sex life is better now that we're doing fertility awareness method, because during that week, we find other things to do that we never thought of before. And I'm like, more power to you. That's amazing. And then there's women who do use barrier methods. So they'll use a condom or a diaphragm, cervical cap, something along those lines to prevent pregnancy. And so it's just all about like what's true for you and what's works for you. And the really cool thing is that in 2018, the FDA, for the first time in history, approved a app to be a contraceptive device, Natural Cycles. It works. So there's Natural Cycles and Daisy that we have in this country in terms of using the thermometer under the tongue. There's also Ava bracelet. I just got sent all the research on that, so I have to like dig into that to understand that a little bit further. But Natural Cycles was the first approved for contraceptive means. And what they found is that, and I want to be really clear, women, so I actually use a Daisy thermometer because it just tells me green light, go, red light, no. Like that's my little rhyme that I have. But I don't negate the signs and symptoms of my body, because we should never take a back seat to our reproductive health. And sometimes women, I'll hear things or people say like, oh, well, this many women got pregnant using fertility awareness method. And it's like, well, were they abstaining from sexual intercourse during their fertile window? Like that matters. You're going to have that self-control a little bit, so to speak. But in addition to that, was she getting signals from the app, which is measuring her temperature, building it into an algorithm and comparing it to other women, but she was seeing fertile cervical mucus and ignoring it? Like, you still need to know what's going on in the nether parts, the nether regions. And if you see cervical mucus that's fertile, that's that raw egg white consistency. And Amy Schumer, I don't know if you guys have seen her stand up.
I have.
Where she's like, it's like someone blew snot in my panties.
Yes,
and I'm like, yes, that's awesome. You want that. That's good. That's some good stuff right there. Progesterone will follow. Like, this is going to be good. So with that, I know. But like, I have women.
It's a great visual.
You like that? But we have women in my clinic in their 40s who they were put on birth control. Like, they had a couple periods. They were put on birth control immediately. They're in their 40s. They come off of it. Call my office in a panic. They're like, there's some weird discharge I've never seen before in my life. Like, I think I have an infection. And then we get into like, what does it look like? And I'm like, congratulations, you're ovulating. They're like, I didn't even know that this happens. Like, yeah, like your vaginal mucus shifts throughout your menstrual cycle. This is why also the movies do a disservice to women when they're like, he just looked at you and there was no condom, no lubricant, nothing. Like, women are going to have periods, it really is around your period, where there's more vaginal dryness. That's not an abnormal thing. And then lubrication is much easier around ovulation. This doesn't mean that you're broken. Like, women will be like, oh, I have to use lubricant. And it's like, yeah, that's how your body works. It's cyclical. That's okay. Like, it just so happens that like in nature, we tend to have sex when we're going to be fertile. But we as humans get to have sex whenever we want. So yay, that. And we've got all of these things that we can use to make it even better. So with that, I think it's, really important that, so in chapter 13 of my book, there's an entire table where it's just like pros and cons of all these methods. It's really important to evaluate like what is best for you and what is true for you and where you're at in your life. Every single form of pregnancy prevention comes with a risk. Fertility awareness method, pull-out method, the risk is getting pregnant. There's a risk there. And so you have to evaluate the risk that you're comfortable taking. And then, if you're going to start any kind of medical intervention, whether it be hormonal birth control or like a copper IUD, which is a non-hormonal birth control, you should monitor your symptoms. Go through an entire menstrual cycle. 3 is even better. Get some baseline labs, then engage in that medical intervention. Because that way, once you know what's normal and true for you, it's a lot harder for your doctor to gaslight you when you go in and say, I started birth control and now X, Y, and Z is different. And they're like, no, you're misremembering this and that. Guess what? I wrote it down. I'm not misremembering. I've got the data right here in front of me. And that helps you not second guess yourself, but also be able to correlate those changes, because it's not like we start the pill and then overnight we have symptoms. Some women do with like depression, anxiety, but for the most part, it tends to be this slow creep, like so many things. And then it just creeps up on you like my child and then farts in your face. Like,
Here it goes.
Oh, sorry, I had to go there.
That was no, this has been an absolute treat. You did not disappoint.
Yeah.
I'm really
awesome.
happy you came on the show.
I'm so glad. And yeah, I think on Instagram, we were tagged so many times together. And that's how I found you guys. And I was like, who are these muscular dudes that like you think I should be on their podcast?
I want to talk about periods and pills.
I was like, do I need to go work out first? Like, what is going to happen here?
No, this is all very, very important stuff that I think the more information people have, the better equipped they are to make decisions for themselves. This is not about whether you should or shouldn't be on the pill and what you should and shouldn't do. It's just, here's the information, here's the real honest information. And unfortunately, I think, and I know you agree, that we just haven't been informing women enough on the full spectrum of information in regards
and
to
discussing the root cause, which you keep referring to, which I think is so important. We talk about that in fitness. I mean, every time someone asks a question to one of us, I'm sure they get tired of always hearing "depends."
Yeah,
from us,
totally.
right? I mean, that's always our answer first is, well, it depends, and then trying to help them get to the root cause and not just address the symptom, right?
Well, yeah, thank you very, very much for coming on the show.
Yeah,
It's been
thanks so
awesome.
much for having me. It's been a
great.
great conversation. This went really fast, you guys.
Yes, it
And also, like, you guys, you got to go check this out on YouTube, because I am so Lily Tomlin right now, sitting in this giant chair, and you don't want to miss out on that. I look like this little tiny kid.
I love that. Thank
your
you.
feet
Thanks
up.
again.
Yeah, thank you.
Appreciate it.
Thank you for listening to Mind Pump. If your goal is to build and shape your body, dramatically improve your health and energy, and maximize your overall performance, check out our discounted RGB Super Bundle at mindpumpmedia.com. The RGB Super Bundle includes MAPS Anabolic, MAPS Performance, and MAPS Aesthetic. 9 months of phased expert exercise programming designed by Sal, Adam, and Justin to systematically transform the way your body looks, feels, and performs. With detailed workout blueprints and over 200 videos, the RGB Super Bundle is like having Sal, Adam, and Justin as your own personal trainers, but at a fraction of the price. The RGB Super Bundle has a full 30-day money-back guarantee, and you can get it now plus other valuable free resources at mindpumpmedia.com. If you enjoy this show, please share the love by leaving us a 5-star rating and review on iTunes, and by introducing Mind Pump to your friends and family. We thank you for your support, and until next time, this is Mind Pump.